Kia ora whānau and welcome back to a Women's Health Action COVID Digi update. We managed to have a pretty good stretch without having any of these updates, but obviously given recent events we are back up in alert levels, level 3 for Auckland, level 2 for the rest of the country. And we're really sending our thoughts out to everybody who's affected by this. Our team here at WHA, we're in Auckland, so we're all working from home during lockdown. In this video, we want to acknowledge all of those of you who may be pregnant right now or have recently given birth. We know based on last lockdown that that's a really stressful experience for a lot of people, understandably so. And it seems like information was changing constantly last lockdown. And we have a little bit of a better picture of what to expect during alert level 2 and 3 if you are pregnant, although the ministry has updated the guidelines a little bit. What I'm going to do today is kind of read off what the ministry is saying now to expect if you are pregnant or giving birth or expecting postnatal care during the lockdown. And I also want to remind everybody that we have a really good library of resources on the Women's Health Action website, which I will link in the description of this video. And on there we have a really big range of videos that we filmed last lockdown. There's all sorts of really helpful information on there for those of you who are pregnant at the moment. We spoke to someone who does obstetric ultrasounds, breastfeeding specialists, all sorts. So I'll link that through and feel free to check those out as well. But yes, like I said in this video, I'm just going to read off the ministry's recommendations for those of you that are pregnant right now. And it's going to be kind of podcast style. I am going to be just reading it off. So feel free to listen while you go about your day and yeah. Your care during pregnancy. If you are pregnant or caring for newborn babies, it is understandable that you may be experiencing heightened levels of anxiety and distress while New Zealand is working to stop the spread of COVID-19. This means your plans about where you would give birth and who would support you may need to change. After 28 weeks pregnant, women should take extra precautions to keep themselves well at a time when growing the baby means higher oxygen demands on the mother. If you are more than 28 weeks pregnant, you should follow the simple ways to protect yourself and others from COVID-19, and you can take extra precautions if you're at risk. If you are working, you should discuss and agree with your employer a simple plan to ensure you can do your job safely, particularly during your last trimester. If you can't safely work at your workplace and you can't work from home, you need to agree what leave from work and pay arrangements will be from your employer. You can find further information about that on the Employment New Zealand website. These leave arrangements may be important to ensure you remain eligible for paid parental leave, so make sure you do look into that. Now, for those of us in Alert Level 3, those of us in Tamaki Makaurau, Auckland right now, this is how your maternity plan may be affected. So your maternity care during Alert Level 3 will be affected. Your midwife or lead maternity carer will do as much as possible over phone or via video calling. Your midwife may decrease the number of in-person visits and will discuss with you the best place to have these. This is to protect you and your midwife from COVID-19 infection. You will be asked to wear a mask throughout your visit and you may need to provide this yourself. So this is a change from last time where all of PPE was provided, but this time you may need to bring your own mask, keeping in line with the recommendation to wear a mask whenever we're leaving our house in Auckland right now. Your midwife or midwifery practice will adjust the way they work to reduce the spread of COVID-19. Before any visit with your midwife, you will be expected to confirm that you are well. If you aren't well, the visit might be postponed or take place via a phone or video call. If the visit's urgent, it will still take place, but you may have to wear a surgical face mask, which your midwife can provide you with. And your midwife will also be wearing some PPE as well. If you've been contact traced due to potential exposure to COVID-19, you've got to tell your midwife or your midwifery practice. And if you've been diagnosed with COVID-19 and that's either for a probable or a confirmed case, you definitely need to tell your midwife or midwifery practice as well. If you've been contact traced and you're less than 37 weeks pregnant, your midwife or GP or obstetrician or LMC may reschedule routine antenatal visits until you have fulfilled the criteria outlined by your local public health unit. You will be notified about what that looks like depending on your current situation, and rescheduling of visits will only happen if your midwife assesses that your maternity care plan can be safely deferred. So if you do need a visit from your midwife, you'll need to wear a surgical face mask, which your midwife can provide you with, and your midwife will also wear some PPE themselves too. If you're more than 37 weeks pregnant, your midwife will continue antenatal visits according to the usual schedule. You will need to wear a surgical face mask during the visit, which your midwife will provide you with, and she'll also be wearing one herself. Pregnant women should follow appropriate mask wearing advice when out in the community. Now for the rest of the country who is sitting at alert level 2, and hopefully for Auckland who will be in level 2 soon, this is how maternity care is looking for all of those people. So maternity care during alert level 2 is affected as well. So if you're in your first or second trimester, your midwife or LMC will do much of your checkup as possible over the phone or via a video call. Your midwife may decrease the number of in-person visits and will discuss with you the best place to have these. This is to protect you and your midwife from COVID-19 infection. Routine and urgent maternity care is vital for the health and well-being of you and your baby, so please ensure that you do continue to engage with your maternity care provider if you have any concerns, and you'll be asked to wear a mask throughout all of your visits, which you may have to provide yourself. And pregnant women in alert level 2 should also follow appropriate mask wearing advice when out in the community. If you develop symptoms of COVID-19, call Healthline, and their number is 0800 358 5453, and follow their advice while waiting for your test result. Healthline is your first line of contact, and then you should also let your midwife or GP, whoever's taking care of your pregnancy, know that you've become unwell. It's important to take care of yourself, and that means taking care of your mental health as well as your physical health, and there's some COVID-19 mental health and wellbeing resources linked as well. Maternity facilities, birthing or delivery suites in hospitals, and birthing units in the community. Primary, secondary and tertiary maternity facilities will remain open to provide services during the COVID-19 pandemic. If you're due to give birth, check with your midwife about the service level available and the visiting policy at your local maternity facility. Postnatal care during COVID-19 pandemic at alert levels 2 and 3. For most women, your in-person visits will be affected. Your midwife will do as much as possible over the phone or via video calling. Your midwife may decrease the number of in-person visits and will discuss with you the best place to have these. Your midwife may ask that no one else is present during checkups, that means no partners, no family members or children, and you will be required to observe strict hygiene measures including physical distancing. The physical assessments of you and your baby will still occur, but they'll be done as quickly as possible. If you require support with breastfeeding, your midwife is still able to provide that to you. You will be asked to wear a mask throughout your visit, and you may have to provide this yourself. If you've been identified as a close contact or a confirmed or probable case of COVID-19, or you develop flu-like symptoms and meet the updated case definition for testing, you must tell your midwife or midwifery practice. If you have been diagnosed with COVID-19 and that's either confirmed or probable, you've got to inform your midwife and your midwifery practice. If you've been contact traced, meet the case definition, or you or someone in your household has been diagnosed with COVID-19, your midwife may reschedule postnatal visits until you've been advised by your local public health unit, Healthline, or your primary care provider that it's safe to recommence visits. The timing of this will depend on your particular situation. Deferring your visits will only happen if your midwife assesses that your postnatal care can be safely deferred. Those are the current guidelines for maternity care during alert level 2 and 3, really similar to last time, and remember we've got all of those resources up on our website for you to check out, as well as the covid19.govt website, and the Ministry of Health also has a lot of resources there as well. We're sending our thoughts out to everyone, and we've done this before, we can do it again, and let's try and get through it as best we can, and we'll see you in our next update. Bye.